Hi, everyone. Thanks for joining us for another one of our live video chats today. Today, we are going to be talking with Chris Ramsey and LaQuinton Jenkins with Simple Choice PPE and Hugh Morrow with Ruby Falls. But we're going to start with Chris and LaQuinton. As always, Q&A will be open from the beginning, so if you've got a question, feel free to type it in there, and I'll be watching those throughout. Welcome, guys.
Thanks for having us, Jeremy, man. We really appreciate this opportunity to talk to some of your members here at the Chamber as well as throughout the region, especially in light of what's going on with the health pandemic, COVID-19. My name is Chris Ramsey. I'm the Chief Operating Officer of Simple Choice PPE, and I've worked in healthcare for over 29 years. Spent much of that time working with Blue Cross Blue Shield of Tennessee, but also I've done a number of things out in the community. Most people are maybe aware of the annual Minority Health Fair. This would have been our 19th year, but due to COVID, we had to actually cancel that. But we're going to do a virtual Minority Health Fair on August the 19th, and that's open to everyone. And we'll share more information on minorityhealthfair.org regarding that virtual health fair. But LaQuinton and I are both independent licensed insurance agents, and we actually we started our company as an extension of our insurance agency. We were actually in the market looking for masks to protect our most vulnerable population, our seniors. And through that effort, of course, we came across a partner, an importer that will be able to help us secure large quantities of PPE. And I'll let LaQuinton talk a little bit about that here in a minute. But I want to spend a couple of minutes talking to your members about some of the things that we're doing in the community. Part of it is about 2 months ago, I was real adamant that there was not enough testing being done widespread to minorities and to the most underserved people in our county. So SIMPA, which was formerly Chattanooga Cares, Aleo Health, which was Hospice of Chattanooga, and Life Springs Pediatric. Over a month ago, we start kicking off testing in some of the minority and underserved communities. The Bethlehem Center is where we held the first testing. We then went to Avondale YFD. We've partnered with La Paz and Clinica Medico, and we've done thousands of tests. Just yesterday, we were in Soddy Daisy, Tennessee. We also did it on Tuesday at Redemption to the Nation with the Chattanooga Sports Ministry. So we've done hundreds of tests, and normally we go out and do 2 sets of tests in different communities every week. And I thank the Chamber for help promoting those test sites. Also, the health department, through a grant through the Community Foundation, they started kicking off tests last weekend at African American churches. So last weekend, we did over 650 tests at the Mount Canaan Baptist Church, which is on Highway 58. And this coming Saturday, we'll be at the Orchard Knob Baptist Church on East 3rd Street. And these tests are open for the entire public. So we actually saw thousands of people come by and do that. But our company, Simple Choice PPE, we also partnered with the Minority Health Fair, CHI Memorial, Aleo Health, the Community Foundation, and Sankofi. We're giving out 10,000 KN95 masks to anyone that comes to the church test sites through the end of August. So everyone that gets tested will get a free KN95 mask. We also doing similar things. LaQuinton, my partner, is located in Houston, Texas. We've partnered with the National Guard and some other nonprofits there to give out PPE equipment, in particular masks. Enterprise, Alabama, that's where LaQuinton is from. And we have plans to do some things in Birmingham and Atlanta. So as you can see, our business is really about giving back to the community. LaQuinton and I are both graduates of UTC. We have a number of clients that we're supplying PPE for. In particular, we're a supplier for the city of Chattanooga, Earl Langer, the Hamilton County School System, the Creative Discovery Museum, and local funeral homes, local daycares, So we're beginning to really build up and support clients as they begin to reopen. So with that said, I'll turn it over to LaQuentin to talk a little bit more about Simple Choice PPE.
Good afternoon, everyone. As you mentioned, I'm LaQuentin Jenkins. I have a special place in my heart for Chattanooga, which is why I live in Texas, but I'm always doing things in the Chattanooga, Atlanta area. I say that's where me and many of my fraternity brothers, we grew from boys to men, which is where I met Chris, and we were taught to serve our communities there. And here we are, 33 years later, doing the exact same thing that we were doing in college and at UTC. We just love the Chattanooga area. But just to elaborate a little bit on what Chris stated, our insurance brokerage operates in about 23 different states. And our primary focus has been on really the small business owner as well as our aging population. We want to make sure that they have a good transition and they have a good, happy, healthy lives. My parents have fallen in that category, so I have a personal interest there. He mentioned National Guard earlier, which is important to me because my father spent almost 40 years in the military, starting with that and then serving in the National Guard. So basically what occurred with us, we found ourselves in a situation where many of our clients, whether they were the business owners, we do a lot of business insurance, as well as many of our clients, they were a bit scared and frustrated. I mean, and they didn't know what they were going to do and how to handle the situations. Many of our small businesses couldn't afford to, but they were closing down for weeks at the time and ended up being months at a time. So as we prepare for what we call the back to church and back to work and back to school, it led us down avenues where I spent 15 years working in that area of distribution operations. I studied industrial engineering at the University of Tennessee at Chattanooga. What I learned there played out well with the relationship we actually, internationally. I was able to call on some of those relationships to help us get what we needed at an affordable price, and also to get boots on the ground. So as we deal with the testing kits, as we deal with the surgical masks, the shields, the infrared thermometers, all the different things that we offer, um, it's proven to be a good situation for us. As a matter of fact, some of our personnel will be coming in from China next on the 17th for training and making sure that we're meeting the needs of our clients. So what our model has been, being from the South, church is important to us and work is important to us and school is important to us. So we were putting together plans and trying to figure out how do we support all those businesses and how do we support our clients who we care about a great deal. The challenge that everyone was faced with was not being able to purchase at a fair price. And Chris and I, we had many conversations, just not happy about the way small businesses were being gouged. The general public were being gouged for PPE equipment, from the mask. I mean, those gloves and masks at one point, particularly the surgical mask, they used to be 10 cents. I seen the situation with it, particularly in Chattanooga, where the school system was being charged significantly more than that. So our model was to come in and provide fair pricing. We are a for-profit business, but as you can tell from my activity, we are very engaged in the community. So a certain part of what we earn goes directly back into the community. As Chris mentioned, we've given out thousands of masks. Our 10,000 mask campaign coming up in Chattanooga. We just worked with the National Guard and some local churches to distribute masks and things in the Houston area last week. And we were preparing to do the same thing. Quite naturally, I always do whatever I do anywhere, I have to do it to my hometown, where I grew up in South Alabama, and which leads to the area in Birmingham. So the thing for us is we want to make sure that everyone understands that, one, we show empathy for the situation that you're going through. We are small business owners ourselves, and we understand the impact of this is cost. So what we've done, we've put together somewhat of a small business consortium, which allows us to purchase at a larger scale so that we may be able to distribute at a smaller scale. So for example, there's some things we deal with that they require 100,000, in some situations even 1 million minimum quantity orders. So we've been able to partner with different people around the country and facilitate orders that would allow us to distribute to the small business owner. So our website, Simple Choice PPE, is a website you can go to if you or anyone has any questions or concern or have a need. And we have a special fondness. We like all small businesses, but our heart still goes back to those foundation, which is our church and our nonprofits in the community. So we, you know, we go above and beyond in trying to make sure we get the lowest cost possible to those individuals, because just like we give away, they do the same thing. They're trying to just get the product into the community. That's the gist of who we are and what we do. As you can tell, Chris and I are pretty passionate about what we do. But we just want to let you know that we're there for you with those needs that you have. We talked to a major uh, manufacturing company this morning that we'll be doing some things, possibly doing some things with in the future. And we are currently supplying to the Department of Revenue in Georgia, the Children's Hospital in Georgia. We just supplied some things to the Georgia FEMA. So we are really excited, and anything we can do to help you, feel free to go to our website, simplechoiceppe.com, and we'll assist you in any way that we can.
Thank you, guys. And we've got some questions coming in. I'm going to circle back to those at the end, so feel free to keep typing those in there, folks. For now, I'm going to go over to Hugh Morrow with Ruby Falls. Thank you for being here so much, Hugh.
It's great to be here. It's great to be on the other side of an opening versus a closing and talking about how to deal with that. So it's very positive. Just to get started, I got to give you a little bit of background. We closed on March the 13th on a Friday evening and furloughed about 80% of our staff the following week. We kept 20%, mostly in the administration area. And all of our people that were on our health insurance, we kept that in place and paid 100% of that through the crisis. The issue we had was the timing of the return. Nobody knew if this was going to go to the following December, or whether it was going to be July or May, or you couldn't get an answer on that, which really changed the cost and how you approach this. But communication was the key. So we started with the first thing we did was we produced a video series for all the people that wanted to come visit us at Ruby Falls. And you got to think about it. We're kind of the antithesis of social distancing in a way, because we bring people together to have a wonderful, unique experience, and then go tell people about it. So it was the connection that we wanted to keep. So, and some of our videos received as many as over 60,000 views to talk about Chattanooga and the Chattanooga area. So it was important. All over the world, people watched these videos. And we touched with social media, and we maintained all of our advertising. We kept our payables and receivables people in place. You still have to pay taxes. You still have to pay electric bills. You still have to do all those things. So those people stayed in place. So there was a cost involved with that. And then we had 8 weeks where we sold no tickets. We had zero revenue for 8 weeks. And not only that, we had negative revenue because we had to give refunds on tickets that had already been purchased. So financially, it was a very difficult time. The tourism and hospitality industry probably was the hardest hit industry of all through this crisis, without a doubt. Restaurants, hotels, attractions, CVBs, et cetera, all lost their revenue streams because, again, we bring people together. That's our job, is to bring people together. So in May, we started all slowly opening. And one of the things that we have done, since PPE is kind of the discussion here, is as we brought our employees back, our team members back, we currently take people through our attraction, 10 people at a time, which is 9 guests plus a tour guide, every 15 minutes. In the past, we took 45 people, 44 plus a tour guide, every 10 minutes. So all of a sudden, we've gone to about 15%, 20% of our capacity, and we're able to allow people through their personal responsibility to have plenty of room to social distance. During our tours of the cavern, they are required to wear a mask. And we started off by giving those away, but we found that people conveniently took one. when they had one in their car. And so when we put a nominal charge on the mask, we found that we sold very few, and that people would go back to their cars, or they'd pull one out of their pocket, or whatever it might be. And we do this again, as y'all mentioned earlier, for protection for the people around them, if they do come in at close contact to them. And we do have an elevator ride involved in it. The elevator ride, what we have been doing is only having family groups or travel groups. We figure if they've ridden in a car together, it's okay for them to take a 30-second elevator ride together. But if there's two people, then they're riding the elevator as two people. We normally put 15 to 17 on that elevator ride. So as you can see, the production is much less. Those things are going to be changing here in the near future, but we'll be getting a few more people in there. Our employees wear masks at all times. They are undergoing temperature checks when they arrive. They get a health screening when they arrive. And if they have any type of symptom whatsoever, they're sent home and they're sent to be tested. We've had that done several times, and we've all had negative tests, going forward with that. We have ample signage throughout the building, requesting people to social distance, to stand in certain lanes and stand certain apart when they're purchasing things. And all of our tickets are being sold through reservations only, online. So you have to go online to do the reservation, so you do not stand in a line to purchase it, nor do you arrive thinking without a ticket, so that we know when they enter the building. This has worked out extremely well as far as how we park people and how we distance people. But we will be adding more capacity to that in the coming weeks. One of the things that we're trying to do, and I told our group this yesterday, is there is no expectation right now that we're going to turn a light switch on and everything's going to go back the way it was. It's going to take constant improvement. And when we first started this, we were doing 200 people a day. I think we did 450 yesterday. And we'll probably move to, in the next 2 weeks, probably to 800 or 900 a day. When we typically, on a very busy July day, would do about 3,500 people. So it's a constant move to grow, as we move forward. Our guests have been very amenable to this, which surprised me. I thought they would be a little more standoffish about it, but I think people understand kind of what's going on and what they've been through. They're doing it at the grocery store, they're doing it to get their nails done, they're doing it to get their hair cut. So to go through this, there's two things that have really been interesting about this, one of which is now is a perfect time to go to Ruby Falls, because you're basically getting a semi-private tour. It's a wonderful time to come up and see us, and you don't have the crowds that we normally have in the summertime. That's number one. Number two is you're spending a lot more time viewing the formations, the falls, etc. In fact, it's been unique. One of the number one complaints we get is people don't get to spend as much time in front of the falls as they would like. Now they're spending double that time, and they're complaining that they're having to stay in there that long. So it's you can't win for losing sometimes. So it has been very unique. Our team members have been great. We had some retire because they were in a older. We had a lot of people who were tour guides in their 70s, and they decided it wasn't smart for them to be exposed to this. And I totally agree with them. I miss them every day. Maybe someday they'll come back, but some of them took retirement, and these were their second jobs anyway after an earlier retirement. But we feel like we're keeping people distanced, and we're keeping them safe, and the proper use of masks and distancing, and we're excited about the future. So thanks, Jeremy.
Thank you, Hugh. So the first question I had come in here is for Chris and LaQuinton. Please talk about your 15-minute COVID-19 test kits.
LaQuinn, I'll let you handle that.
Okay. So there's two types of tests, and the 15-minute test is an antibody test, and basically what it does, it tells whether or not you've had been in contact, whether it could have been something in the past, or it can be something in the near future. It's not the one that determines whether or not you actually have the virus. It's more of an indicator that you've been in contact with. So you could have been in contact with it, weeks ago. Your body's adjusted. You've gone through the 14-day period or whatever time frame is necessary, and your body has just adjusted. It doesn't affect you in that way. But it is not a true indicator of you have the condition that you can infect someone at that time. The PCR test, the testing that's, we call it the short term for it, we call it the nasal swab, which generally takes a longer period of time, determines what level you are in that process, whether you're actively have the virus, or whether or not you've had it and your body's adjusted to it, that you're not a threat. And now we have actually another graduate of UTC who's a physician in hospitals in Atlanta. You get to think everybody a part of our company went to UTC. He's our advisor, and unfortunately he had the condition. His wife had the condition. His mother had the condition, and two of his sisters had the condition. So we stay very in tune. We're very conscious that if they're involved in the rapid testing, it's not a true indicator that you don't have it. You have to do the nasal swab to determine if you currently can infect someone. So it's more of an indicator that you have or have not been in contact with the coronavirus.
Okay. Hugh, have you all made adjustments to your cleaning regimen along with everything else?
Yes, I left that out. I apologize. We do a deep cleaning and attempted sterilization of the building and bathrooms, which most people are doing with their cleaning crews now. And we do cleaning throughout the day, which we would not have done in the past. The cave is a little bit different. It's a natural area with natural rocks, and the data that we're getting back on that is very difficult to wipe down a rock, so to speak. But the handrails within the cave are being wiped down periodically during the day as well. So, and the elevator is being cleaned multiple times during the day. So yes, we've added to that.
Have y'all adjusted your hours since you're having to take less people through at a time now?
We actually adjusted them to shorter hours, and now we're going back to an 8 to 8 because of demand. We didn't think there'd be a lot of demand for late evening tours, but we found that there are because of we don't have as much capacity. So we will be extending our hours back to 8 to 8 here shortly.
Okay. And LaQuinton, I haven't had the test myself personally, but I've watched my wife have it. It didn't look pleasant. I'll say that much. Can you sort of talk about the process of actually getting tested?
Well, things are changing a little bit. We've had several situations that have to, this is a constant evolution in the hospital systems themselves. Many of the big hospitals, particularly in the Atlanta area, they've developed their own in-house testing. So the process as it is now, there are tests that are out that they don't have to go as deep in the nasal cavity. I admit, when I saw live television, the governor of New York get the test, and he was doing everything in his power not to, and they stuck it into his brain. It's not as, in most situations now, it's not as aggressive. And actually, Chris sees it happens on a daily basis. He's part of our staff. that's out there every week, multiple times a week, and he can actually tell you even better than I can as it relates to, even though I'm on the technical side of it, he's on the side of it where he's there facilitating people, thousands of people going through that process. So Chris, can you speak to that experience that you're seeing with many of the people that participate?
Yeah, I'll be happy to. And the thing that I would say is that it may be 1 or 2 minutes of discomfort, but you're going to know your status. So the tests that are being done in the community, whether it's the health department, it's Sempris Leo Health, it's the National Guards, all of these are clinical personnel that are doing the test. So they're either nurses or they're MDs or they're nurse assistants. So primarily what they'll do, they'll swab one nostril, one nasal cavity, and they'll rotate it a few times to make sure they get enough on the swab. And that's really it. They'll ask you to hold your head back. A lot of these places have drive-through, so you don't even have a car. And again, it may be a couple of minutes of discomfort. That we have tissue available in case your eyes start running.
I think Chris froze up.
But again, I would
Yeah.
encourage people, especially if
Oh,
you're experiencing any symptoms, and as you all know, we have really increased the testing here in Hamilton County.
Well,
okay.
I've physically seen people go through the experience, and unfortunately, I lost a classmate last week to it. And as I mentioned, our consulting physician, his sister has been in the hospital for 3 months. She was in a coma for 6 weeks. So I assure you, the discomfort of the test is a lot less painful than the experience of the condition.
Absolutely. Yeah, no, definitely. If anyone, one thing we've heard over and over again, we've had several medical professionals on these video chats at this point. If there's one thing they've all said, it's if you have symptoms that you suspect may be COVID related at all, talk to a doctor, get tested. It's not worth the risk.
Our concern is that it's going to the possibility of it spiking again. And also, as we go into cold and flu season, who knows what's what, right? That's our concern, is what happens as we move into cold and flu season. How do you differentiate between who does and who doesn't? Because you have a fever, you have those same symptoms. So, we just urge people to get tested and practice the social distancing as much as possible.
Absolutely. Along those lines, Hugh, uh, it sounds like Ruby Falls is doing everything you can to keep people safe, which is great. And so people can feel confident, going there, that they're going to be as protected as they can be. What, based on your experience, what should people be looking for when they're thinking about going to an attraction or a gathering space like yours that is opening back up?
Well, over the last 8 weeks, I've chaired the attraction subcommittee for the Economic Recovery Group, and we had people from Dollywood, Graceland, the Nashville Zoo, the Ripley's Aquarium. I can go down the whole list on that committee. And the key to it is as you approach a business, everybody has been educated to know if people are taking the proper precautions and they're not having gross negligence and putting everybody, putting 12 people in a small bathroom or something. I mean, I'm thinking of things of that nature. You know it as you go to the grocery store, you know it as you go to a mall, if you go to get your hair cut, are they doing this thing properly? And so you just got to steer clear of so if you come walking up to Ruby Falls and if we're lining people up shoulder to shoulder to go through an attraction, you need to just walk away and use a little bit of personal common sense on those things. But any of the businesses that have taken the Tennessee Pledge, follow those guidelines, follow those protocols, you're gonna see it with a sign out front that they're following it and being a part of those protocols. Hope that answered your question.
Yeah, definitely. Okay, I think that covers everything I had. Thank you all for being here again. This has been really informative. I think a lot of our members will find this valuable. As always, if someone wasn't able to attend this live, the recording of this will go up on our website shortly afterwards. Chris and LaQuinton, could you say that website one more time?
SimpleChoicePPE.com. That's SimpleChoicePPE.com. We want
Excellent.
to
Thank
say
you.
thanks to Hugh because the first visit I had, my first main visit when I was recruited by UTC, I played football there, was to Ruby Falls, and that's a memorable experience. So thank you for what you're doing.
Thank you. It hasn't changed much. Come see us.
Yes, sir.
All right. So if you're looking for a good local distributor of PPE, check out Simple Choice. And if you're looking to get outside of your house for a change, sounds like there's never been a better time to go check out Ruby Falls. Thank you all for being here so much.
Thank you. Thank you.
Blessings to everyone. Thank you.